Okay, let's just take a few moments to review how it is we can break down our Practice Act. But I think it's best to first take a look at what exactly is an athletic trainer, what can we do, how are we defined, what are our practice domains, who are our patients, what are the settings, all those kind of things that we practice as an athletic trainer within. So let's start with that. What exactly can we do and what are we as athletic trainers? So let's just take a look at our main page here on My Graceland, and let's start with that. I want you to go ahead and we can scroll down here, and we've got some options we want to look at. Well, we can look at certainly the role delineations, delineation and the scope of practice of athletic training. This is a very large document, and you can utilize that, and it's pretty thorough. You can take a look, but if you really just kind of want a basic breakdown, a great place to look is through our National Athletic Trainers Association webpage, and I'm going to take you through just a couple of those links and identify and outline some of those key aspects to identifying what it is exactly that we are and that we can do and where we can practice as an athletic trainer. So I'm going to start right here with the AT professional terminology. And there's some things I want to draw your attention to. So here is, a certified athletic trainer. What it is, we are healthcare professionals who collaborate, and that's a key word, collaborate with physicians. And we're going to point out down here, if we look a little bit further on down, we talk about athletic trainers functioning under a physician. They talk about the terms direction, okay, or we talk about the term supervision. Ideally, we either collaborate with the physician as identified above, or we are under the direction of a physician versus supervision. Direction allows us, and collaboration allows us a lot more freedom within our scope of practice to work as an athletic trainer. Supervision, in some cases, may actually require that we have an on-site physical presence, as they note here, of the physician. But again, it may depend on how the Practice Act is worded, but ideally, again, our State Practice Act would talk about or utilize the terminology collaborate or under the direction of versus supervision. Now, as we look at services, we note that it entails prevention, emergency care, clinical diagnosis, therapeutic intervention, and rehabilitation. And this is of injuries and medical conditions, and that is important because we should be able to treat both injuries and illness as it relates to the population of patients and the skill set that we have. We should be able to operate within that for both injuries and illness. So if we look at the typical patients and clients that we serve as an athletic trainer, we're looking at this. Our typical patient, traditional I should say, would include recreational, amateur, and professional athletes. And by common sense, it might be these individuals who have suffered musculoskeletal injuries. But don't limit yourself to the idea that it must just be athletes. Again, this says individuals. And then it's those seeking strength and conditioning, fitness, and performance enhancement. And then here's a key term, or others as designated by the physician. So again, in collaboration with those physicians, if the physician deems it best that an athletic trainer serve the needs of that patient, they're the ones that should determine that. So again, in our state practice acts, ideal language or model language would allow us to have patients that are delegated by the physician in need of our services. To differentiate between this term patient or client, it does so again down here. An athlete or a person that's injured, he or she may become a patient once they've had that injury. However, we may use the term client if we're more involved in those situations with the strength and conditioning. I'm sorry, I don't want to use that term. The sport enhancement or the training and conditioning aspect, and or in situations where it's really preventative in nature. okay? And that might be, and consider in that case that we might be working with a client. But again, make sure you look at your individual state and that you're operating within your scope of practice. So where is it that you might find an athletic trainer? Obviously, there's the traditional athletic training facilities, and that may or may not be located within a school, your traditional K through 12 colleges or universities. Again, to note that as we move into this century, we want to utilize the term athletic training facilities or athletic training clinics versus athletic training rooms. That denotes, again, more of the allied health aspect of athletic training and what we provide. You have your amateur, professional, and Olympic sport venues, clinics, hospitals, physicians' offices, community facilities. This could include recreation centers and that, but the other thing we want to know is workplaces, and this can be commercial or government. Depending upon the nature of the work, this could be an industrial setting. This might be working with our servicemen and women, with the military. It might be working with firemen, policemen, and things like that. But these can be in workplaces, so this really opens up the settings in which we can practice. So all of these things are extremely important as we analyze our practice acts. We want to make sure that we can work within our full capacity and training as an athletic trainer. Again, go ahead and look at the definition of an athletic trainer, how we work and collaborate with physicians, what services we provide, what type of patients we work with, what settings that we may work in. So those are some key things that you can find on the NATA website. So if I come back here, the next thing we want to look at is, in order to do those services, we have to have a certain education. And those can be best outlined if we take a look here. Again, this is the website through the NATA. And so we have the NATA Athletic Training Educational domains. And it talks about entry-level education, but here's what we want to pay attention to. How are we educated as athletic trainers? Well, we're educated in risk management, injury prevention. We are educated in the pathology of injuries and illnesses. We know how to do the clinical examination and diagnosis of orthopedic injuries. We know how to evaluate medical conditions and disabilities and appropriate referral for injuries and illness in those medical conditions. Same thing, how to manage emergent or acute care of injuries and illnesses, therapeutic modalities, conditioning, rehabilitation exercises, along with pharmacology. This is your therapeutic intervention, psychosocial intervention and referral. Some of you may think of this as counseling. When is it appropriate to refer our patients or our clients to other healthcare professionals or counselors? The nutritional aspects of injuries and illnesses, and lastly, healthcare administration, which includes professional development. So all of these are areas that you must understand that this is what we do, this is our knowledge, and this is what we have to learn to become this credentialed allied health professional that is an athletic trainer. So in understanding that, don't pigeonhole yourselves to just this idea that we work in a traditional setting, which is that high school, college, university setting, and that we only work on athletes. We are really a much more expansive, much more talented, knowledgeable profession than what we typically pigeonhole ourselves to be. So once we understand this, we can really break down a practice act. So I hope this helps.